Hello, surgical technologists. Let's get into Unit 7 where we talk about urine and genital cultures. We'll talk a little bit about normal flora and we'll also talk about the pathogens. So let's get started. So urine is considered a sterile body fluid. If it is properly collected, there shouldn't be any bacteria in the urine. However, if the urine sits out at room temperature for an extended period of time, contaminating skin flora can actually grow in that urine sample. Um, some of contaminating skin flora would be things like coag-negative staph or lactobacillus. Now, on the other hand, if a patient has a true infection, they're going to grow bacteria in that urine, not because it's a skin contaminant, but because it's a true pathogen. And some of the pathogens are Escherichia coli, Proteus mirabilis, and Staphylococcus saprophyticus. Urinary tract infections are very, very common. There's about 2.7 million people that visit the hospital ER every year for urinary tract infections. They can be upper or lower urinary tract infections. The upper urinary tract infection includes the kidneys and ureters, while the lower urinary tract infection could include the bladder, the urethra, and in males, the prostate. Some patients have just one episode in their lifetime, and others have several chronic urinary tract infections. Often the cause of a UTI are the gram-negative enterics, and that would be E. coli is your number one cause of a urinary tract infection, and Proteus mirabilis is the number two cause of a urinary tract infection. Bacteriuria is a term that means bacteria in the urine. So like I said, urine is a sterile body fluid. So if a person has a urinary tract infection or a UTI, how does that bacteria get into the urinary tract? And there are three ways. The bacteria can get into the urinary tract through the ascending route, which is most commonly the way that gut flora gets into the urethra. And that would be from the anus, GI flora that goes to the urethra, up to the bladder, up the ureters, and into the kidneys. A lot of times that is seen in females that are wiping the incorrect way. They can also appear in urine because of the hematogenous route, and that is bacteria that originated in the blood and is not filtered out by the kidneys. And that's when a person has bacteremia, which is an intermittent showering of bacteria into the blood, and then those bacteria are not filtered out by the kidneys and they can end up in the urine. And then finally, the third way that people can get infections of the urinary tract is through the lymphatic pathway, where the lymphatic flow is contaminated with bacteria that is directed through the kidney. Okay, so here's a few terms that you're going to want to be familiar with, and they refer to where an infection is isolated. So cystitis refers to an infection of the bladder, while pyelonephritis refers to an infection of the kidney. Anytime you're going to do a urine culture, usually what precedes the urine culture is a urinalysis, and that includes a physical exam, a chemical exam, and a microscopic exam. So the physical exam of a urine from a person that has a urinary tract infection is yellow and hazy or turbid. Sometimes it could be pink or red if there's blood cells in there, but most of the time, if it's just a UTI, it's yellow, hazy, or turbid. The chemical exam for a person that has an infection is going to reveal a positive leukocyte esterase test, and that's basically a chemical that comes from the destruction of white cells, a positive nitrite exam, which usually is associated with urinteric organisms. They reduce nitrates to nitrites. And then finally, there could be blood on the chemical exam as well. Microscopically, if you have a patient that has a urinary tract infection, you're likely to see bacteria, white cells, maybe some blood, and possibly casts, which are basically a cylindrical item made in the nephron of the kidney that has kind of a protein matrix, and it's shaped like a cigar. The signs and symptoms of a urinary tract infection are pretty, there's quite a few of them. For example, you could have a fever, chills, flank pain or a heaviness of the abdominal region, Frequent, urgent, and painful urination. I always think of that movie, The Green Mile, when Tom Hanks had a urinary tract infection and he compared it to peeing needles. Turbid or foaming urine, and then urine with a strong ammonia odor, and then other symptoms would be nausea. The symptoms can be very similar to vaginitis or prostatitis as well, so you have to be careful that these are associated with urinary tract infections and not vaginitis or prostatitis. In order to help the physician diagnose a urinary tract infection, we have to first collect the specimen, and we want to make sure that that specimen is properly collected. Usually the specimen of choice for a urinary culture is a clean catch midstream specimen. And what that means is the external skin and genitalia are cleaned, and then the midstream of the urine is collected. So the first few mils of urine are discarded, we collect the midstream, and then we get rid of the last few mils. And the reason that we do a clean catch midstream specimen is because we want to avoid collecting skin flora or anything that's going to contaminate our culture. Then after the specimen is collected properly, we want to complete the physical, chemical, and microscopic exam on the sample, and that's usually done in the urinalysis department in the lab. And then they'll interpret the initial findings, and then the sample is cultured if indicated. So in other words, if they have nitrite that's positive, if they have white cells that are positive, if they see white cells or bacteria, they're going to go ahead and culture it. Then in the microbiology lab, the organisms that are causing the UTI are identified, and finally susceptibility testing is done. And what I mean by that is testing against different antibiotics to see if certain antibiotics will work for that patient or will they not work. Like I said, there are a number of different types of urine specimens that we can collect for culture. A clean catch is again when they clean the external genitalia or skin around the urethra, and those samples are cleaned, and then we collect the urine sample. A midstream is when they are collecting the middle portion of the urine void. They're actually discarding the first few mils and the last few mils, and they're collecting the midstream sample. A catheterized specimen is when they actually take a tube and go into the urethra and collect the urine. One is called an indwelling catheter and one is called a straight catheter. An indwelling catheter is a catheter that stays in for a long period of time, and you usually see this with elderly patients or patients that are paralyzed or for some reason can't urinate or are incontinent, and we would have an indwelling catheter with those populations. A straight cath is a catheter that's inserted into your patient for just a few moments while they collect the urine. It doesn't actually stay in the urethra. And then we have suprapubic aspiration, which is actually where they take a needle and a syringe and they aspirate urine directly from the bladder. That's a surgical procedure where they're looking for anaerobes. And then cystoscopy is actually more like a sample collection directly from the kidney. Usually they're not looking for UTIs here. More often they're looking for kidney cellular inclusions and things of that nature. And then just so you understand, once the urine sample gets to the laboratory, there are a number of things that happens in the laboratory. The container is examined for acceptability. We want to make sure that the sample is sterile and that the urine hasn't spilled in the bag or something like that. We want to double check the accompanying requisition and make sure that we're dealing with an actual urine sample and not something else. Mix the urine thoroughly by swirling it, and then we may be required to prepare a gram stain for an unspun urine and correlate the gram stain to determine if the findings are going to be significant. Then we set up culture plates in a pour plate fashion where we're using calibrated loops to set up the cultures for growth. And usually that's 2 blood augers and a McConkey auger. EMB is similar to McConkey. It is a mildly selective media that has lactose in it, just like McConkey does. In order for the microbiologist to determine if the results are accurate, the microbiology lab needs to know the collection method. Was it a clean catch midstream or was it a catheterized specimen? How significant is the colony count? We need to know the date and time that the specimen was collected and also what time it was delivered to the laboratory. We need to know if they're on any antibiotics, because if there's antibiotics given before the culture, that can actually make your organism kind of gork out and not act right. And then we need to know their clinical diagnosis. That's helpful in knowing what organisms they're likely to grow, and it's very helpful to get a patient history. So here's a list of things that you're definitely going to need to know for your board certification. Common pathogens in urine cultures would be Escherichia coli. That's probably the #1 cause of urinary tract infections. Proteus mirabilis is the #2 cause. Those are both enterics. Klebsiella, Enterobacter, those are both enterics as well. So again, those first 4 bullet organisms there are from the gut. Then we've got Enterococcus faecalis, which is a common cause of urinary tract infections, and it is a gut strep. Staphylococcus aureus is another cause of UTIs. Staph saprophyticus, that's usually more common in women of childbearing age. Streptococcus group B, Pseudomonas aeruginosa, Acinetobacter, which is a non-fermenter, closely related to Pseudomonas, Streptococcus group A, and Candida albicans. These are all organisms that you might find in a urine culture. Now, urine should be sterile, but the skin and genitalia around the urethra have contaminating organisms that are completely normal. And some normal skin flora would be Staphylococcus epidermidis, or pretty much any coag-negative staph, diphtheroids, lactobacillus, Streptococcus viridans, or Bacteroides, which is an anaerobe. So let's talk about Escherichia genus. It is the #1 cause of urinary tract infections, and there are 7 species of Escherichia, but I want to focus primarily on Escherichia coli because that is the #1 most commonly isolated organism causing a urinary tract infection. It is normal gastrointestinal flora of the gut, but if a female wipes incorrectly, you can actually take those gastrointestinal organisms and pull them into the urethra, and then they go up into the urinary tract via the ascending route and cause urinary tract infections. Now, Escherichia, we identify these enzymatically and metabolically, but I don't want to get into that too much here because that's probably beyond the scope of what you need to know. Like most gastrointestinal organisms, we can actually serotype this genus, and there are 170 different serological types of Escherichia, and they are closely related to Shigella. Genetically, they have similar DNA, and they can produce toxins that are similar to Shigella as well. And if you remember from other lectures, Shigella is an organism that causes gastroenteritis. Escherichia is normal GI flora, so most serotypes and species are completely normal flora of the gut. They can cause dysentery like diarrheal diseases, especially the ON57H7 strain. They are the #1 cause of urinary tract infections, and they can cause endocarditis as well. They may be very resistant to certain drugs like the penicillins, the ampicillins, and the 3rd and 4th generation cephalosporins. Because of that reason, they are classified as an ESBL, an extended spectrum beta-lactamase producer. And beta-lactamase just refers to the type of drug. Penicillin and ampicillin are beta-lactam drugs. Proteus mirabilis is the 2nd most common organism to cause a urinary tract infection. And the organism Proteus is actually named after Proteus, the god of the sea, and its ability to change shape. And you can see on the image there that this organism swarms across the plate in waves. Proteus is normal flora in the gastrointestinal tract, and these numbers can increase in patients that are taking oral antibiotics in the gut. It may cause urinary tract infections and wound infections as well. And we would identify these using metabolic ways to identify them. Like pretty much any species of gut flora, Klebsiella can cause a urinary tract infection as well, although it's not as common as E. coli or Proteus mirabilis. There are 8 species of Klebsiella, and they are non-motile and vigorous gas producers. On the MacConkey agar, as you can see there, and even on sheep's blood agar, they can be very mucoid because they have a capsule. The body has a difficult time fighting off Klebsiella because it is encapsulated, and our second line of defense, our white cells, our neutrophils, monocytes, and macrophages have a tough time phagocytizing these organisms because they are encapsulated. Pseudomonas aeruginosa is an organism that can cause a urinary tract infection. It's what we call a non-fermenter. And it's a little bit different than the other gut organisms I've talked about so far because it doesn't ferment glucose. Okay, and that's why it's called a non-fermenter. It is an organism that is pretty commonly isolated in the clinical lab. About 15% of all isolates are non-fermenters. This is the most frequently encountered non-fermenter, and it likes moist environments. So it stands to reason that it is the cause of burn infections, swimmer's ear, cutaneous wound infections, respiratory infections, eye infections, and also urinary tract infections. And that because it has a kind of a special affinity to wet environments. It produces a number of exotoxins, proteases, and extracellular slime, so it can be resistant to many antibiotics. It produces cytochrome oxidase and has a strong odor of grapes, and it is green pigmented. It's a gram-negative rod. You probably don't need to get too carried away memorizing this particular slide, but I just wanted to go over a few characteristics of Pseudomonas aeruginosa. It is metallic green and beta hemolytic. It can have a metallic sheen as well. It is cytochrome oxidase positive. It's a glucose oxidizer, but it's not a fermenter. It grows on MacConkey, and it grows well at 42 degrees. And the triple sugar iron agar shows that it does not ferment any other sugars. It doesn't ferment glucose either. It actually oxidizes it. And then we would identify Pseudomonas aeruginosa through metabolic means, looking at lysine and ornithine decarboxylation. And it does reduce nitrates to nitrites. Treating Pseudomonas aeruginosa can be difficult, even if it's an organism causing a urinary tract infection or a wound infection. It may be resistant to many antibiotics. It's usually susceptible to the aminoglycosides, that would be gentamicin, streptomycin, and tobramycin. And it's also susceptible to the carboxypenicillins, which would be carbenicillin and ticaracillin. It's usually susceptible to the third and fourth generation cephalosporins, and one such example would be ceftazidime. And what they may do is actually give two antibiotics together that work better together or better synergistically than they do independently. There are a number of body sites on the male that can be cultured, but usually what's cultured from the male looking for genital tract pathogens would be the urethra. But the internal structures of the male genital tract would be the testes, the epididymis, seminal vesicles, urethra, and prostate, while the external components of a male's anatomy would include the penis and the urethra. But it is usually the urethra that is cultured for genital tract infections. In females, the most common sample type for genital tract infections would be the endocervix. But internal components of the female genital tract would include the ovaries, the fallopian tubes, the uterus, endometrium, cervix, vagina, and urethra, while as the external components would include the labia and the urethra. But usually it's the endocervix or endocervical cultures that are collected for genital tract infections. So like I've already mentioned, the most common specimens for culture in males would be urethral specimens. And what they do is they take a mini tip swab and they insert it about 3 to 4 centimeters into the anterior urethra to collect that specimen. And in females, it's an endocervical specimen that's generally collected for genital cultures. And a catheter is actually inserted into the endometrial cavity. The mini tip swab is transferred through the catheter, inserted a few millimeters past the cervix, and collected that way. There's a number of organisms that constitute normal vaginal flora. That flora will actually vary with the pH of the vagina. Lactobacillus, which is a chaining gram-positive rod, is normal vaginal flora that makes lactic acid, keeping the vagina pH slightly acidic at a pH of around 4 to 5. Most pathogens don't like that pH, and that keeps pathogens at bay. The flora will vary with the amount of vaginal secretions, and it's also going to vary with levels of estrogen. Normal vaginal flora organisms would include coag-negative staphylococcus, micrococcus, enterococcus, a few enterococcus. You don't want pure enterococcus, that could be a problem. Streptococcus viridans, an anaerobe known as Peptostreptococcus, Bacteroides, which is also an anaerobe, miscellaneous gram-positive rods like Lactobacillus and Diphtheroids, Streptococcus group B, and again, that's normal flora for a female. However, if mom is pregnant and she gives birth to a baby with strep B, that can be a real problem. Staphylococcus aureus in low numbers and enterics in low numbers. That's all normal vaginal flora. Now, males don't have any normal urethral flora per se, but they do have skin flora colonizing around the urethra, and that skin flora would be things like coag-negative staphylococcus, diphtheroids, miscellaneous alpha and gamma strep. There are many organisms that are considered to be genital tract pathogens, including Trichomonas vaginalis, that's a parasite, Candida albicans, which is a yeast, Neisseria gonorrhea, Treponema pallidum, that's syphilis, Haemophilus ducreyi, strep A, Chlamydia trachomatis, herpes simplex virus, listeria, strep B. Those are problematic for the baby if mom gives birth and she is colonized with listeria or strep B. And then Staphylococcus aureus and enterics if they are there in moderate to high numbers. Neisseria gonorrhea is unfortunately a sexually transmitted disease that is pretty common, and it is best cultured on a selective media known as modified Thayer-Martin agar. It's kind of like a chocolate agar, but it has a high amount of dextrose in it, and it also repels the growth of other organisms, so it's selective for Neisseria gonorrhea. And if you were to look at the fermentative qualities of Neisseria gonorrhea, it is glucose positive, so it will ferment glucose. It is maltose, sucrose, and lactose negative. If you were to gram stain Neisseria gonorrhea, you would see their gram-negative diplococci, and they may actually be inside of the neutrophils. They may be intracellular. And they are cytochrome oxidase positive, and if you recall from previous lectures, they're actually catalase positive as well. So here's a nice image of a direct gram stain from either a urethral sample or an endocervical sample, but you can see many white cells, and you can see in the cytoplasm of the white cells many gram-negative diplococci. Those big pink things that you're seeing are the lobes of your neutrophils, which are your white cells, and then the little pink dots, those are the kidney bean-shaped gram-negative diplococci that are inside the cytoplasm of the white cell. This is what it would look like on a gram stain if your patient had Neisseria gonorrhea. 12 million people get syphilis annually in the world, and there are about 10,000 cases a year in the United States. During its heyday was during World War II, and there were approximately 500,000 cases a year in the United States. Treponema pallidum is the organism that causes syphilis. It is a larger, tightly coiled spirochete, and it can actually penetrate intact skin, much like Shigella can. It is best diagnosed with dark field exam, where you're looking for the bright colored spirochetes on a dark background. Ways that we can diagnose Treponema pallidum are serological, with the direct fluorescent antibody test, or a serum test known as the VDRL or RPR test. Those are screening tests. But culturing is actually the gold standard, but it's very expensive and time consuming. Sometimes Treponema pallidum is referred to as the great intimidator because the symptoms are so nonspecific and resemble many other illnesses. People that have primary syphilis will develop what's known as a chancre, And then in secondary syphilis, they will develop a rash on their hands and feet. And then finally, in tertiary syphilis, it moves to their central nervous system, and they will have central nervous system depression. So here in these images on the top left, you can see a gram stain of the spirochetes. They usually don't gram stain very well. So the best way to identify a case of primary syphilis is by doing a dark field exam. And you can see the brightly colored spirochetes on the upper right-hand image. And then in secondary syphilis, the patients will get these lesions on their trunk and also on the soles of their hands and on the bottoms of their feet. And you can see that in the bottom images there. Chlamydia trachomatis is the #1 cause of sexually transmitted diseases in the U.S. There are about 900,000 cases every year in the United States. It is considered a parasite in some textbooks and an intracellular bacterium in others. They won't gram stain, but they have a cell wall similar to a gram-negative organism. Many infections are actually considered asymptomatic and they're easily transmittable. It is considered a sexually transmitted disease and it can go from mom to baby. In females, it can lead to bad things such as pelvic inflammatory disease. The specimens are obtained from cervical scrapings or mini-tip collection, and it is diagnosed from cell cultures. That's where we culture living cells, Giemsa stains, fluorescent antibody staining, or DNA probes, which is a molecular way of identifying chlamydia. Gardnerella vaginalis is normal flora of the vagina. However, when all the rest of the normal flora is out of whack, Gardnerella vaginalis can sort of take over and cause what's known as vaginosis. It is not a sexually transmitted disease, however. When staining it, it is a pleomorphic gram-negative rod, but a lot of the times they stain gram-variable. They are very highly associated with what we call clue cells, and a clue cell is a squamous epithelial cell or a vaginal lining cell that actually looks as though it's been coated in bacteria, and that's called a clue cell. You can see that on a vaginal wet prep where you do a wet prep with saline and vaginal secretions. Sample positive for Gardnerella vaginosus will emit a fishy-like odor when combined with KOH. And that's because when you take potassium hydroxide and Gardnerella, it creates amines, and those amines tend to have a fish-like odor. So in this image, you can see an example of a clue cell noted in a vaginal wet prep. If you take a look at the left hand side of the image, you have a normal squamous epithelial cell that it's a little bit sticky. There might be a few colonies of bacteria stuck to it, or you could see a few little keratin granules there. But if you look at the cell dead center, you can see that it's absolutely completely covered in bacteria, and that's called a clue cell. It's highly associated with Gardnerella vaginalis. Gardnerella vaginalis looks like dust on blood and chocolate agar. It's very hard to see what the colonies are going to look like because they are so tiny the first 48 to 72 hours. Incidentally, they are catalase negative and oxidase negative. They will break down starches, and they're beta hemolytic on horse blood tween agar and V agar, which is selective for Gardnerella vaginalis. Unlike Haemophilus, they don't require X or V factors, so you're not going to get them confused with Haemophilus. And Haemophilus is much larger at 24 hours. Trichomonas vaginalis is a protozoan parasite. It's usually diagnosed by finding the motile flagellates in a saline wet prep. It has what's known as a twitching motility. Motility is only apparent when the sample is examined immediately because the motility is not going to last for very long. There is a culture media, but how good it is actually pretty questionable. They can be identified serologically, which might be a better way to diagnose Trichomonas vaginalis, even though culture is the gold standard. So here's a drawing of Trichomonas vaginalis. It's about the size of a white cell, and you can see that it has 4 anterior flagella and an undulating membrane on the top left. The circle in the middle is the nucleus, and then the line going down the middle to the posterior is called the axostyle, which is basically a spine that holds the flagella anteriorly. On the top right image, you can see a gram stain of trichomonas, and even that's tough to distinguish what it is. And at the bottom right, we've got motile parasites in a wet prep. If you click on the link, you should be able to go to YouTube and watch a video of the motile organisms on a wet prep. Candida species is a yeast. And yeast, having a yeast infection is not considered having a sexually transmitted disease. In fact, 75% of all females will have a yeast infection in their lifetime. Yeast is usually Candida albicans. 50% of the time or more, you're dealing with Candida albicans. It is associated with pregnancy and the change of hormones, overuse of antibiotics, having diabetes, or being on steroid therapy. These are all reasons why a person can get a Candida albicans yeast infection. It can be seen on a wet prep or a gram stain, and if we wanted to culture it, the best media for isolation and cultivation of yeast is sabrodextrose. So here's a nice image of a mature Candida albicans. You can see that the terminal chlamydospores are at the ends of the pseudohyphae, and they're long and branching, and you'd pretty easily be able to notice this on a vaginal wet prep. Herpes simplex virus is pretty common. According to the Centers for Disease Control, 20% of adults have genital herpes. That's 1 in 4 males and 1 in 6 females. There are several types or several members of the herpes virus group, including HSV type 1, which is the cause of cold sores, HSV type 2, which is the cause of genital herpes, and that can actually go from mom to baby. We also have human cytomegalovirus, Epstein-Barr virus, and varicella-zoster virus that can cause chickenpox and lead to shingles. Cold sores from herpes virus is always type 1, but genital herpes can be either serovirus type 1 or 2, but 75% of the time it is type 2. The best way to diagnose herpes is with a molecular type of technique. You could actually use a live cell culture, but live cell cultures can take up to 14 days, where a molecular type of test can be run within a day. The most common viral STD is papillomaviruses. In fact, there are 6.2 million cases every year in the U.S. The human papillomavirus, or HPV, causes genital warts. There are 60 genetic types of HPV, and those are actually considered genetic variants. Many studies have concluded that colonization with HPV increases the chance of cervical cancer. Cervical epithelial cells look abnormal or have a coarse clumping chromatin that may be a clue towards the diagnosis of HPV. So here's an example of epithelial cells, and you can see that the cells that are infected with HPV have a paranuclear halo around the nucleus, and then they have dense chromatin. Chromatin is basically genetic material, and you can see inside the nucleus of the epithelial cell that you have some dark spots, and that's actually dense chromatin. There is no permanent cure for human papillomavirus, but there are a few treatments like cryotherapy, laser surgery, and alpha interferon injection. So this concludes Unit 7, everything you ever wondered about genital cultures and pathogens. If you have any questions, just reach out and I will get back to you. Have a great day.